Good evening, this is Dr. Dumestri, and I'm going to kick off my next mini-series discussing implant removal, implant exchange, and all of your options for that, discussing breast implant illness. So this is a topic that I have received many questions regarding, but I really wanted to take my time, sift through the evidence, and try my best to deliver a concise summary on what it is, what are the actual high quality studies looking at it, and go over some of these key findings. So what is breast implant illness? So this is actually more accurately described nowadays as SSBI, or systemic symptoms associated with breast implants. This is a whole group of symptoms that women will report and believe to be linked to their breast implants, and they include symptoms such as fatigue, joint pain, hair loss, anxiety, depression, autoimmune diseases, rashes, headaches. And there have been many studies that have looked at this entity and of very varying levels of evidence. So a lot of anecdotes, patients' personal experiences, case reports, so just one single study, or just poor quality studies that don't have long-term follow-up, don't assess for a lot of confounding factors or other factors that can play into the development of these symptoms. But in this group of women who experience these symptoms, a big percentage of them get better with implant removal. So I'm going to go over some of the most recent studies. These were published in 2022, 2023, and it's a 4-part series of very high quality evidence. So what does that mean? It's looking at patients from a starting point going forward, so prospective study. It's blinded, meaning the investigators don't know which group each patient is in, and it also has long-term follow-up and involves comparison groups. So in this study, they were basically looking at the different theories of what causes breast illness. So some of these theories are silicone gel bleed or leakage of the silicone into your system, heavy metals that are leached from the implant that cause toxicity and therefore medical problems, and the presence of bacteria. So this study looked at 3 different groups or cohorts. First group was women who had self-diagnosed breast implant illness and were seeking implant removal. The second group was a group of women who have breast implants and were seeking breast implant exchange or removal for reasons completely unrelated to breast implant illness, so they felt fine. And then the third group of women is patients who never had any breast implants. They just had a breast lift, so they were a good control group to look at breast tissue analysis, symptoms in people who have never had the implants. So the first paper looked at the impact of removing the capsule at the time of implant removal and whether that had an impact on symptoms. So the capsule is the thin layer of scar tissue that is around the implant. This forms around any foreign body that enters you. So it could be a wood splinter forms a little capsule. Same thing, a breast implant will form a capsule. Now, in the breast implant illness community, there's a lot of talk for need for en-bloc capsulectomy and implant removal, meaning you're taking everything out as one big chunk with a layer of healthy tissue. This has a lot of potential complications such as breast deformity, post-op bleeds, or even a popped lung or pneumothorax. So in the study, when they looked at the effect of capsule removal, they did find that in their breast implant illness cohort, 96% of patients did get better with removal of the implants. And of those, there was a whole variety of patients who'd had 0 capsule removed, little bit of capsule removed, or the entire capsule removed en bloc. And they found that there was no difference in symptom relief. So removing the capsule is not necessary to achieve symptom relief in breast implant illness. Second study then looked at the presence of heavy metals in the actual capsule surrounding the breast implant compared to just healthy breast tissue in the lift patient group. And they found that although trace amounts of heavy metals are present, these are also present in the breast tissue of healthy women. The amounts found were far under the levels of concern for toxicity, and the presence of them in healthy individuals points to the fact that all of us consume heavy metals in the water we drink, in the tattoos we get. If you're a smoker, that contains heavy metals. The food that we ingest, dyes. There's so many other ways to ingest these heavy metals, but there's no evidence to support heavy metals as a cause of breast implant illness for these reasons. Now, the third study, they looked at the presence of bacteria on the capsules and sought to see if there was a bacterial association with this. And again, there was no association found. Next, they look at the presence of silicone bleed, so how much silicone is leached from the body with a silicone implant. And they found that although there is known silicone bleed with silicone implants, the rates are really low. And when you look at the cohort of breast implant illness patients, there is similar numbers of those with saline implants and silicone implants. Although the saline implants are wrapped in a silicone shell, the shell itself, when we look at the amount of silicone that's leached, it's so minute that it wouldn't be a causative factor for this. And then the last study, or last part of their study, was looking at long-term symptom improvement. So yes, we know these patients get better at 3 weeks, 6 weeks, a few months out. Is this resolution of symptoms consistent at a year post-surgery? And the study found that yes, indeed, symptom resolution is consistent, which is great. So at a year out, these women are still feeling better from having their implants removed. So what does this all mean? Unfortunately, it still means that this is an entity, the systemic symptoms associated with breast implants, or SSBI, is an entity that we still do not fully understand. It is a diagnosis of exclusion. There are no specific symptoms that mean, yes, this is breast implant illness, and there are no consistent biomedical markers or blood or tissue tests that can tell you if you do have it. It is important to have a full medical workup, as these same constellation of symptoms can be found with many other medical conditions such as fibromyalgia, chronic fatigue syndrome, heightened chemical sensitivities, mental health issues. So you really want to make sure that you have a full medical workup first. There is definitely a role for implant removal. I have done implant removals for patients who have presented to me with SSBI, and they have done very well with their implant removal. There is no role for capsulectomy, and especially no role for en-bloc capsulectomy, which is actually removing your own healthy tissue and increasing all of those risks with no demonstrated benefit. I hope that helps. Leave your questions in the comments. I will do my best to answer. This is a very controversial topic with lots of opinions, but this is the best evidence that we have to date. Many women do very well with their breast implants, but there's always things that we don't know and always certain things that won't work for certain people. Have a great evening.